Minister, thanks for coming into the House today. And I'd like to raise the issue facing 20,000 people in Ireland today that have type 1 diabetes. And the latest data from across the globe shows, and indeed the HSE advice states as well, that those with diabetes face far worse outcomes if they contract COVID-19. And the HSE has advised diabetes patients at all stages to try and avoid GP practices, to try and avoid hospitals where they can. And yet, despite these warnings, I think at times over the last 12 months, there's been little way in terms of joined up thinking in order to put those patients first and to make sure that we have some class care for them. And 6 months ago, indeed, in the Oireachtas Special Committee on the COVID-19 response, Diabetes Ireland specifically recommended that the HSE should consider or should develop a clinical consultation service for type 1 diabetes patients, and indeed to extend the flash glucose monitoring devices to all people with type 1 diabetes who have complex needs. However, to date, officials have spent about 2 years, 24 months in total, reviewing the addition of flash glucose monitoring to the long-term illness scheme for people over the age of 21 years of age. Notwithstanding the risks continue to grow, and while 1 million people have been vaccinated as of the weekend, we have to be mindful, certainly, that the virus is still here with us and is still in our communities. And those vulnerable patients, even though we are very far through the cohort 4 vaccination process, those vulnerable patients, including those with diabetes, are still at risk. So the health arguments are very clear as well. But aside from the health arguments been very clear, the arguments in relation to value for money are even clearer. And indeed, there's other products on the market that many patients with diabetes have advised me are at least €1,000 a year per cheaper. So it makes no sense to exclude them in the first instance from the long-term illness scheme. And that's really what I'm here for today to try and say. And it's especially the case when we see the HSE budget is growing and growing and growing. And indeed, I've spoken to a lot of people who have type 1 diabetes in my home county, and they have said that it would just make total and utter sense to have flash glucose monitoring on the long-term illness scheme for them in the first instance. And they have a very, clear thought process about this, that it makes sense, it is the way forward. And I'm just here today to really try and encourage the government to add that to the long-term illness scheme in the first instance. And last weekend after Cabinet, we saw the Minister for Public Expenditure and Reform, Michael McGrath, say, and I quote, that right across government we need to see an emphasis on reforms and ensuring that we're getting good value for people's money that we're spending. So the message is really clear about this. It is good value for people's money. If we add it to the long-term illness scheme, I think it would go a long way towards doing that. And in particular, I really appreciate, Minister, the help and assistance that you've given me on this issue. You and your department and your special advisors have always been, the door has always been very open to me on this particular issue over the last couple of months, and I'm really happy to take that opportunity to thank you on the floor of the House today.
Minister, you have 4 minutes.
Thank you, and I'd like to thank the Senator for raising this very important issue. And the COVID-19 vaccine allocation strategy sets out a provisional list of groups for vaccination. The strategy was developed by the National Immunisation Advisory Committee, or NIAC, and the Department of Health endorsed by the National Public Health Emergency Team, or NEPHIT, and approved by Government on the 8th of December 2020. Vaccine allocation is a matter for my department, and the rollout of the COVID-19 vaccination programme is the responsibility of the HSE. And as you will be aware, on the 23rd of February, I announced an update to Ireland's COVID-19 vaccine allocation strategy. In comprising the initial vaccine allocation strategy, the NIAC listed several conditions associated with increased risk of severe disease and death. In the intervening period, national and international evidence has become available, which has enabled a more detailed analysis of underlying conditions that may increase the risk of developing severe disease or death. The NIAC has now been able to identify more comprehensively those medical conditions and to distinguish between those which place a person at very high risk or high risk of severe disease if they contract the virus. Medical conditions and magnitude of the risk they pose will continue to be monitored and periodically reviewed. On the 30th of March, the Government approved a further update to the COVID-19 vaccination allocation strategy. and based on clinical, scientific and ethical frameworks produced by the National Immunisation Advisory Committee and my department, following the vaccination of those most at risk, future groups will be vaccinated by age in cohorts of 10 years. The move to an age-based model better supports the programme objectives by protecting those at higher risk of severe disease first, which benefits everyone most, facilitating planning and execution of the programme across the entire country, and improving transparency and fairness. People with diabetes are included in 3 different groups in the vaccine allocation strategy as follows. Group 4, which comprises people aged 16 to 69 with a medical condition that puts them at very high risk of severe disease and death, includes those with diabetes who have HbA1c level of greater than or equal to 58 millimoles per mole. Group 5, which comprises people aged 65 to 69 whose underlying condition puts them at high risk of severe disease and death, including all other diabetes type 1 and 2. And finally, Group 7, which comprises people aged 16 to 64 who have an underlying condition that puts them at high risk of severe disease and death, including all other diabetes type 1 and 2. It is important to note that vaccination of Group 4 began in March and vaccination registration for Group 5 began on the 15th of April. And in addition, vaccine registration for those aged 60 to 64 commenced on the 23rd of April. The NIA continues to monitor data around COVID-19 and indeed emerging data on effectiveness of vaccines on a rollout basis. And Senator, you raised the fact 1 or 2 issues there that wasn't included in my statement, and we will try to get you an answer on that as well.
Thank you very much, Minister. Yeah, and just to conclude, I suppose my just couple of asks about this, which I'd really appreciate it if in your written response you could come back to me about, would be, first of all, is the development of a virtual consultation service. I think that we've seen now with the way COVID has gone over the last year, all of that type of virtual stuff, online stuff, it makes total and utter sense, whereas perhaps before COVID it was harder to get something like that to happen. It makes sense now. I think we should look at it. The second one is having the flash glucose monitoring devices added to the long-term illness scheme. I think that's really important that we do that, because the point about it is it's €1,000 a year cheaper. The health arguments are clear and the financial arguments are clear. And I think for those basic reasons that we should really consider doing this sooner rather than later.
Thanks. Well, the flash glucose monitoring devices, I will raise that in the department, and I'm sure as part of all the various issues it will be considered. And as you know, vaccination is recognised as one of the cost-effective and successful public health interventions that exist, and the WHO estimates that 2.3 million deaths a year are prevented by vaccination, and a further 1.5 could be avoided if global coverage of vaccinations improved. The COVID-19 pandemic has served to underscore the importance of the vaccination programme for the protection of public health on a global scale. And finally, it is important to emphasise that vaccination is only one part of our response to the prevention of COVID-19 infection, and people who are vaccinated need to continue with all public health measures that have been proven to reduce the risk of infection, i.e. limiting our social contacts, physical distancing, wearing a mask, hand hygiene, cough etiquette, and avoiding non-essential travel until a sufficiently large proportion of the population are immune.